So let's talk about cerebral circulation. Cerebral circulation is essentially nothing but the intracranial vasculature, which we divide into anterior circulation and posterior circulation based upon its origin. It is divided into these two. Posterior circulation includes all the arteries which arise from the vertebrobasilar trunk. So it also includes its terminal branch, that is the posterior cerebral artery as well. Anything other than the vertebrobasilar trunk comes under the anterior circulation. Therefore, it also includes arteries of branches of the internal carotid artery, like the anterior cerebral artery, the middle cerebral artery, and the communicating arteries, which are again anterior communicating artery and posterior communicating artery. What we have to remember is that posterior communicating artery is not a part of posterior circulation. It is part of anterior circulation, essentially because it is the branch of internal carotid artery. So let's start the topic by talking about internal carotid artery. Internal carotid artery is divided into 7 segments by Butterfly. Therefore, it is called as Butterfly's classification. And it has 7 segments, and the odd numbered segments, that is the 1, 3, 5, and 7, essentially do not have any branches. The even numbered segments, that is the 2, 4, and 6, have branches, and they have 2 branches each. So let's uh, discuss about the internal carotid artery and its course on this axial CT. Contrast enhanced CT angiobrain. Here we can see at the level of the thorax, the two arteries, that is the ascending aorta and the descending aorta. If we scroll cranially, we can see the arch of the aorta over here. If we scroll more cranially, we can see the branches of the arch of the aorta. Now the 3 branches, namely from the right towards the left, the brachiocephalic trunk, the common carotid artery, and the left subclavian artery. If we scroll more cranially and continue tracing the brachiocephalic trunk on the right, we can see that it divides itself into two arteries, namely the right subclavian artery as well as the right common carotid artery. Now, since our topic of discussion is the internal carotid artery, let's continue tracing the common carotid artery. And if we go more cranially, we know that common carotid artery divides into internal carotid artery and external carotid artery. Here we can see two arteries. One artery is present inferolaterally, another one is present posterolaterally, another one is present anteromedially. If we scroll more cranially, we can see that the anteromedial artery is giving branches. So essentially, this artery, anteromedial one, is the external carotid artery, and the internal carotid artery, the posterolateral one, which is present just medial to the internal jugular vein. If we continue tracing the internal carotid artery, this part, what we are tracing right now, is essentially C1, which is the cervical part. As we already discussed, since it is an odd segment, C1, it does not give any major branches at the level of neck. However, if we trace the artery more cranially, we can see that the C1 part of the internal carotid artery can be seen entering into the internal carotid canal. Here, due to the contrast difference between the artery and the bone, and due to the window level, we are not able to see it properly. So I am changing the window to bone window in order to delineate it well. Here we can see the internal carotid artery. Um, Here we can see the internal carotid artery present in the carotid canal. Here we can see the foramen ovale. Just lateral to it, we can see the foramen spinosum, and here over here, this is the foramen lacerum. And if and the second part, which is entering into the petrous part of the temporal bone, is called as the petrous segment of the internal carotid artery. Since it is even segment, we know that it gives 2 branches, and the 2 branches over here is the Vidian's artery, which is also known as the artery of the pteryoid canal, and another artery is the keratoid tympanic artery, which goes into the middle ear and supplies it. We cannot see them clearly, but we can see the C2 segment of the internal carotid artery is giving a branch over here and going into the Vidian's canal, which is the Vidian's artery. However, if we scroll more cranially, we can see the internal carotid artery present in the internal in the carotid canal is entering into the foramen lacerum, which is the third part, which is the laceral part. As we all know, since it is an odd segment, it does not produce any major branches as such. But anyway, what is noteworthy between C1 and C2 is that C1 internal carotid artery, which is essentially present in the neck, and the C2 internal carotid artery is present in the bony canal. Therefore, there is a sudden shift between very much mobile C1 part and not so mobile C2 part. Therefore, there is always a risk. It is more vulnerable to traumatic shearing forces and also dissection injuries between C1 and C2. The C3 part, lacerum part, is a very small segment which essentially does not give any branches, and the C3 part is usually covered by the trigeminal ganglion of the fifth cranial nerve. And if we trace more cranially, we can see the cavernous segment. What we have essentially important is that the cavernous segment actually has a can be called as five segments of it based upon its cores, which we cannot see properly on this axial section, but if but it will be better seen on the sagittal. So let's trace the artery in the sagittal section. So yeah, the artery present over here. This is the internal carotid artery, which is seen exiting from the foramen lacerum. This is the C4 part, the cavernous part of the internal carotid artery. We can see that it has a vertical segment, the first part, and a posterior genu, the second part, the horizontal segment, which is the third part, and anterior genu, the fourth part, which and it ends by the fifth part, which is the subclenoid part, which is just below the clinoid process. And if we scroll a little sagittally, we can see all the segments, all the parts of the C4 part of the internal carotid artery, which is the cavernous segment. Uh, and since it is the even segment, we know that it gives two branches. The two branches are the meningohypophyseal trunk as well as the inferolateral trunk. The meningohypophyseal trunk usually arises from this part, that is the genu part. Usually, they are too small to delineate on a CT angio. Usually, the meningohypophyseal trunk supplies the pituitary, the tentorium, as well as the clival dura. The inferolateral trunk arises usually, well, it says the inferolateral, obviously. It arises from the lateral aspect of the ICA, that is the intracavernous part of the ICA. It supplies the cranial nerves as well as the dura. Well, what is important about this inferolateral trunk is that the inferolateral trunk anastomoses freely with the branches of external carotid artery. Therefore, internal carotid artery anastomoses with external carotid artery via the inferolateral trunk, which is part of the C4 part of the internal carotid artery. This is very important because um, whenever there is a source, any case type of occlusion of ICA, this connection, this communication acts as an important source of collateral blood flow between ECA and ICA. And C5 part, which is can be seen just at the level of the clinoid process, that is the C5 part, which essentially is the clinoid segment. Clinoid segment, since it is an odd segment, it does not give any branches. And anyway, it is a very short segment. Then it continues. If we change our view to the axial section, um, and if we trace this internal carotid artery present over here cranially, we can see that this part, this is the internal carotid artery. We can see that this internal carotid artery is giving a segment over here. This essentially, if we cruise cranially, it gives us the ophthalmic segment. Ophthalmic segment is an even part of the internal carotid artery, therefore it will give branches, and the ophthalmic segment gives us two branches. One is the important One, the ophthalmic artery, which can be seen here. This is the internal carotid artery, the C6 part of the internal carotid artery, and this one is the ophthalmic branch of the C6 part. And the second branch given by the ophthalmic segment of the internal carotid artery is the um, superior hypophyseal artery. Well, as the name itself is self-explanatory, it arises from the sixth part of the ICA and supplies the superior part, that is the anterior pituitary lobe retinohypophysis, the infundibular stalk, and also supplies a bit of optic chiasm. Then it ends finally via the C7 segment, which is also called as the communicating segment. And the communicating segment is the last part. Since it is the odd numbered segment, it does not give any branches. Anyway, if we see in this axial section at the level of the brain, we can see that the most distal ICA segment gives us two branches essentially. One of them, which we can see here clearly, is the posterior communicating artery present over here, the posterior communicating artery, which joins the anterior to the posterior circulation, and it also gives a number of perforating branches arising which arises from the posterior communicating artery to supply the basal structures of the brain, including the hypothalamus. Well, it also gives an artery which is difficult to delineate, hence CT angio as the anterior choroidal artery, the thin artery which is coming over here, the anterior carotid artery. Usually, this one is the posterior communicating artery. If we scroll cranially, the anterior choroidal artery rises usually 1 or 2 millimeters above the posterior communicating artery. The small branch where is the anterior carotid artery. Anterior carotid artery is essentially uh, reciprocal to the posterior carotid artery. Posterior carotid artery, which is nothing but the branch of the posterior communicating artery. This is the end of the part 1 of the lecture. Let's continue our discussion on cerebral circulation in the next part.